Planning and Infrastructure Expo Conference 2025. I would like to call the next panel. The panel is that will be our final panel for the day. Focuses on agility and resilience in healthcare logistics, the lifeline of healthcare, reimagining hospital supply chains. The moderator of this panel will be Ashish Rohilla, founder and CEO, Ashish Rohilla and Company. Vikas Goyal, SCM Head, Fortis Memorial Institute. Survpriya Singh, Biomedical Engineer, ILBS. Sonu Kumar Yadav, founder and CEO, hospitalstore.com. Asha Pant, Deputy GM, SCM, Dharamshila, Narayana Hospital. Now we can begin this session.
So, what an event, HPIE so far. So many discussions, thoughts, interactions happening here under this platform. Courtesy Mr. Afzal Kamal, very happy to see these things happening here. Topic given to us is like hospital supply chain, resilience and speed. Looking at this hospital and healthcare, we have a lot of challenges in the case of pandemics or disasters coming in the industry. Looking at what were the scenarios during COVID times and what are the scenarios if there's a war between two countries. So from that perspective, procurement plays an important role, and we have great panelists here from various backgrounds. Just a background, like supply chain is a $3.3 billion industry globally, out of which we have $25.7 billion of value which we can save through enhancing supply chain. First of all, there are various aspects which we would be discussing today, like what the strategy, automations, what government can play a role, what are the partnerships, collaboration needs to be done, how industries are working right now in the terms of supply chain, government as well as private. So I welcome everybody here, and let's start from Survpriya. He is in a government entity, and I was having an interaction with him. Let's understand how supply chain first of all is working in our country, and do we really need to work on the new innovations in the industry?
Am I audible? Yeah, very good evening to everyone. And it's a nice and a very warm occasion in which I am speaking. I'm actually heading the Biomedical Unit and Institute of Liver and Bowel Sciences, which is a autonomous institute and a very super specialty hospital in Delhi. So in government sector, it's like when we are procuring things or when we are maintaining the supply chain. So we have a tender system. It's not like that we can go from a buyer and buy the things. We have certain things to be met, and that we call a tendering system. So it's a quite complex system in which government usually works, because we have two things which is very have to be kept in mind, like accountability and then a real transferability in which transparency is there. The procurement, the supply chain, we cannot just stick on the one vendor. We have to have a numerous vendor, and this what we are the tendering system we do. Now presently the government is all relying on the GEM. I think so most of you are aware about the GEM regarding these things. So earlier it was like a open tender kind of thing, and we have to select one vendor who is L1. L1 is the lowest vendor who usually quote the things and at the lowest price. Now it's all over, it's changed, and it is now more open system in GEM, in which all over of India, somebody can, if you're sitting in Delhi, he can sell you the things. And that is a really tough thing coming up. Usually what was happening earlier, like we were buying from the local vendors, and usually they used to quote their prices. Now, after introduction jam, it is very transferability, but the thing is that the supply chain has to seek improvement because it has to maintain a timeline and it has to sustain the requirement of the user.
Thank you. Mr. Vikas is working with Fortis, and yeah, please your thoughts on how it is working in your industry.
Good afternoon. So if we see as a Fortis Healthcare, as a supply chain in Fortis Healthcare, so the 40% of our revenue goes in a procurement, supply chain and logistics part in the hospital. So as in a Fortis, it's one of the important area, and it's not only working on a cost containment, we have worked on a standardization, quality control, compliance regulations, meeting the sustainability and ESG, which is the recently goal for all the corporate hospitals, and the starting point for getting the right material, which is environmental friendly and fulfilling all the norms of sustainability. That started from the supply chain point of view. So considering the cost, standardization, quality, compliance and ESG. These are the points which supply chain is look after in a Fortis hospital.
Thank you, Mr. Vikas. Sonu, you manages a company hospital store, and we were talking backstage about like the domestic procurement capabilities and the international capabilities. So looking at the international scenarios, we are talking about in a country where currently we are importing 80% of medical devices across other countries, and now we are planning to export. So what are the challenges? There are so many regulations happening in the industry also. If looking from that perspective, how do you see how soon we would be able to export our products to other countries, and what do you see should be the procurement supply chain so that it should be helpful in the cases of any challenges in the world?
Good evening, everyone. My name is Sonu Kumar. I'm founder and CEO of hospitalstore.com. We are online B2B platform for medical equipment and supplies. We supply medical equipment and disposable accessories to all over India and exported more than 82 countries. Now let us come to your question, Ashish. Since we earlier we were supplying in India, and we started getting the inquiries from all over the world, and today also as a platform we rank all over the world and we get the inquiries from multiple countries. Initially we started, let us try it, okay? And as a small shipment, we started it, and we initially faced the problem of compliance, and first problem was having the free sale certificate, okay? And nowadays also most of the companies, they don't know what is the free sale certificate, and you cannot export the medical supplies and equipment without the free sale certificate. And that was the first challenge. Our team went to the DGFT as a startup. It took almost 1 month for us to get the DGFT, and that was also not directly. You know, you go to that DGFT, you will get all these, agents in their office, and it's very difficult to get the free sales. Somehow we got it, and then we started exporting it. Next challenge was related to the compliance, right? Medical equipment supplies is very unique supply chain where
Quality is another part, compliance and regulation is another part, but looking at from the supply chain perspective,
right,
what countries we should be like focusing, and how is our mode, like where we are exporting right now?
I think African market is one of the emerging market.
The global south.
Yeah.
A lot of policies are coming from government perspective.
So US is already a developed market. I see future lies in the African market and the Asian market in terms of exporting the medical equipment.
When we are working about resilience and speed, it's not always that we are looking forward to receive the products from other countries, but how we can export and help other countries in the terms of when there is a war-like situations, when there is a pandemic happening. So how we can help them in sending it. So the whole idea of today's conversation is to understand how we look for processes, how we look for challenges, like because there are people involved, there are technologies involved, there are so many processes which are involved in fulfilling one procurement. If we have product in my hospital right now, my inventory, my central warehouse, I am okay. but looking at the challenges when there are geographical issues, when there are war-like situations, how we can handle. Are we ready for that situation? Are we ready for maybe the doomsday, right? So how we make our procurement strategy so strong, whether we need to incorporate artificial intelligence, IoTs, whether we need to look for how much stock we have in our inventory, real-time stats, real-time ERP. Vikas company is managing a very nice ERP softwares on that. So a lot of aspects we need to look for when we are working on advancing procurement for the country, for our institutions. So, like now moving back to Asha ji, she is from Narayana, and would like to hear her thought first, like how she sees procurement in the terms of resilience and speed. Are we following the right things? Are there any challenges which we have seen as a part of the industry, in the processes, in the peoples, in the manufacturings, in the trading organization? So the whole supply chain, whole equilibrium of transferring one product from to the end stage. So how do you see that? Like, what are the challenges there, or how it is growing? We are growing as an organizations.
Good evening, everyone. I'm Asha Pant from Narayana Health. So, as our panel topic says, that supply chain for resilience and speed. So, I would retaliate that the supply chain is not a back office function now. Supply chain is the lifeline of the hospital. So, without the supply chain department, the hospital cannot function. So, in 2 decades of experience, what I can find, we have seen that manual model from the cost-centric model, we have totally shifted to a AI-based hospital. The supply chain is much educated, it is empowered, and we have thought all those functionality with the time that everything is automated. So the processes and everything becomes simpler, more accurate and efficient.
So do you see the real time that are we able to predict that XY amount of inventory if we need to procure well in advance, looking at maybe the patient's flow
Yeah, definitely.
in the hospitals?
See, initially it was all manual based Excel calculations and more of manual interventions.
Right.
So over the time, everything has moved to BI tools. We have the auto calculation, which is more accurate. We can consider the vendor lead time, we can consider the buffer stock, and all those, considering the location, the turnaround time. So over the time, we can have a shift from just in time to the planning of the inventory. So more of the inventory is reduced. Lot of injections, lot of medicine in the hospital. We have a well-planned hospital management system where we know which patients, which season, everything is being considered while having an inventory. So the inventory days is reduced a lot in the hospital.
So technology is playing an important role, as you have mentioned, in your institutions also. But looking like also how the compliance quality also coming into the picture. I understand that we shortlist few vendors based on that, okay, first level we need to procure products from this company, second this company. Price is also another factor, speed is also another factor, but also considering whether the manufacturers are producing enough products for us. Have we ever faced those challenges in the organizations, or what's your thought on that?
See, I would not say it's a challenge, but in the industry, yes, because our industry has lot of such Me Too companies nowadays that everyone is manufacturing the same molecule, and we have to ensure that the manufacturing, the quality of the medications, everything should be up to the mark so that we can service the patient, because patient care is the first priority.
Right.
We cannot just take any item just because it's a low cost. So cost is not only the factor. We have a committee, it's a group of doctors, it has a group of companies and every management where we discuss with these new brands, new molecules which are launched, the new companies which are being launched, because that is the main quality factor which will help to recover the patient fast. And in a hospital, if the patient recover fast, then definitely the hospital will be benefited at that point.
Very well said. I mean, that is what I was looking for also. Innovation plays an important role, right? I mean, we are not going traditionally that, okay, these are the products we need to buy, but who are the startups? PM Modi is like promoting Startup India, Make in India, and a lot of people are talking about maybe CE regulations or FDA approved regulations, right? I mean, but there are products which India is also manufacturing, how we are promoting that in the terms of where we are sitting at the procurement level, where we have the authority of approving the products. So that also plays an important role. Very well said, and very
That's
happy.
the important role the supply chain head has, because that is the reason this department is there in the hospital, to have those quality checks, and all those compliances are considered before taking that particular company into the system.
Very nice.
So we have FDA approvals, we have drug control, DCGI approvals, all those manufacturing approvals. In a lot of cases, we do visit the manufacturer site also to see if what is their manufacturing practices, and all those compliances are being considered.
So coming back to Survpriya ji here, very well said, ma'am. I will come back to you also. Looking at the government and the private organizations, procurement planning understands there is a centralized gem procurement happening, but how fast is that? Either we should rely in the terms of challenges, in the terms of disasters, say for example, how we can rely. I'm not sure, maybe the government organizations are having the inventory storage facility also. Are we looking for 20 days turnaround time? We are talking about the consumable here, not about the capital equipments. But how we see in the government organization, is there a need for innovation? Is there a need for a change? Or maybe if we need to suggest to government about the policy improvement in the products, because there are a lot of policies happening at the medtech level, procuring, manufacturing, so many policies are happening, but looking at the procurement level, what are the things they should be okay that we should be buying? What are the factors you are looking at? Your thoughts?
See, the quality has to be kept first, whether it is a private or a government organization. And when the quality comes into the picture, the cost arises. Now the thing is that like for the normal machines, equipments, like the consumables, I think after GEM is coming, we got so many local manufacturers which are doing good. Maybe they are assembling the things. Maybe they are getting the things from
Make
outside.
in India initiative.
Yeah, but the Make in India has emerged. Earlier, we were not finding any kind of local vendors like which you can rely about. I will tell you, in the time of COVID, around 60% of the equipment which come free of cost was from the Indian manufacturers. And I can tell you, I was inside the ICU, I can find those things. It has helped a lot. Because that time you have to maintain the patient and you don't have a basic things. Every country was maintaining its own pitch. If suppose we rely on the Dragar, on the, not to quote any company, they were self-reliant and they were making their own machines, and they have their own shortages. They have their own supply chain problem. How they were catered? They were catered through the Make in India concept, and I really appreciate what the government has done through GEM. And we have got a local manufacturer which is coming, and now the things are getting exported. But on the contrary, if you are comparing the good equipments like the quality equipments, there should be some kind of channel management thing. Or you can say a tier 1, tier 2, tier 3. If the equipment are like produced, like they have a set value of like 50 years, 60 years back, like a very good companies, they should be in the higher tiers. It means that good companies should compare with each other. And if you're coming down, like every ICUs have a different required, ward has a different required, and even the OPDs have a different required. We can cater with if you are considering a ward and an OPD, you can have a normal equipment. You don't require a very high-end equipment, which was established. But coming to the ICUs and all, you obviously require a good equipment, and that the government should focus on, how to do about that. So this is the challenges which are facing right now.
So coming back to Sonu, we talk about the war and pandemics here, but very important aspect which we see in daily news is like economic wars. right? I mean, across the borders, if we are sharing and sending our products, what are the things we should be ready for, either in importing or exporting to other countries, looking at those scenarios in our procurement strategies for, again, resilience and speed.
Ashish, I would like to say, first of all, we have been planning, designing, and all this from last 2 days, I think 3 days, right? So now, if we consider, can we execute it without a solid supply chain? It's really not possible. So we all have seen during the COVID time how fragile our supply chains, traditional supply chains are, right? Now we need to fix these supply chains. That's really we cannot consider, like Asha said, supply chain is not just back-end office work nowadays. Supply chain is a lifeline of a hospital. That's why with hospital with a broken supply chain is like without a heartbeat, I would say.
Absolutely.
Okay,
Right.
and I would say as a country, we more need to focus on the self-reliant, because in this type of situations, definitely it is somewhere going to impact, because we are importing more than 80% medical equipment from out of country, and we need to hospitals need to find the they just don't need to depend on their own supplier. They need to find out the suppliers of suppliers, right? So in this way, they need to enhance the suppliers network. We need to manufacture in India. In this way, I think we can solve this kind of problem.
Right. So very, very well said. I mean, definitely we should incorporate those thoughts in strategy planning, policy planning. Again, the next level of point I would like to cover is like about the data. Data is the new king also. Data is the next oil also. A lot of data you are creating at Fortis. I'm aware of that right now. Oracle ERP system, and you're doing each and every transaction, who is buying what, from where, buying what pricing they are buying. Looking at that, if you are sitting on the edge and you're managing technology very nicely and doing predictive and analytical thoughts on that, do you see that it will bring more enabling of organizations? Or how do you see how you are going to use the data related to procurements and the supply chain in your organization?
It's a very important and very valid questions right now, because if we see in supply chain, the transparency, visibility, even the real-time visibility is required for the top management to the stores people. Because in a hospital, we are using a lot of inventory. Around 8 to 10,000 different SKUs are used in a hospital, and their visibility on a real-time basis, what stock is available, which is going to be exhausted, which orders are in pending, which are there is a rates approvals are pending, what are their quality assurance are pending over there. So all such things are required, and for getting real-time visibility, or even in a corporate hospitals, the chain of hospitals, what they are doing in individual centers, that has to be visible to the top management. For that, the ERP is required, and for that, we require a centralized data masters for vendors, suppliers, items, and which are integrated to each other, and whatever the transactions the unit is doing, that has to be updated on a real-time basis. So in a Fortis, so we are using Oracle software, which is all the 28 hospitals are aligned together, all masters management, their MDM management, transactions management, all are interlinked with each other, and we can see what are the transactions happening, what are the stock position are happening, what are stock on arrival, what are stock not to be arrival over here, what are the POs are going to be expired and not delivered to us, that all informations are real-time available on us. Second, on the previous question, I just would like to add for innovation. Now there is a concept of make in India, use the Indian products over there. If we see in last 10 years, the multinational players, the consumption of the MNC's products are reducing, and the Indian players are taking a place over there. But still, it's a very nascent stage, and the two aspects are required for the Indian manufacturers. One is a quality. So if we see a lot of substandards, adulterated, misbranded, substituted products are coming in the hospitals, which are giving a very bad impact on the patients, to the healthcare providers over there. Second, the manufacturers have to have a quality assurance product at their site, at their manufacturing site. whatever they are sending material out from their manufacturing unit, that has to be tried and tested, and then they have to be released to the hospitals.
Very nice, very nice. Very amazing thoughts. Coming back to Asha ji, I would like to know more about supplier relationship. How you see supplier relationships plays an important role in procurement strategies, and again, if we have good terms with national and international players, how that is going to play. How do you see it as an industry? How the relationship works? Because technology is at the one end of it, but we should not forget, in those days when technology doesn't work and there is a breakdown, we should be also relying on the people also, the kind of relation we are having, the kind of agreements we are having. How do you see your organizations is moving forward in that space?
Supplier relationship is very important for the supply chain, because supplier relationship helps us to improve our inventory, the services, and nowadays most of the companies are digitalized, so there are a lot of links where we can have a visibility of the transactions of the supplies. So when the supplies are being sent, it is already informed to the user. We can have a tracking mechanism of that. We get an auto emailer from a lot of companies when they directly send the supplies, so that we can track out where the supplies is. Also, as a supply chain management, when we work in a hospital, we try to consolidate a lot of vendors. Before introducing a vendor, we definitely want to visit their site on the storage conditions. That is a very important factor in a hospital, and the source of procurement.
Right.
So, to identify a supplier, first we need to go to the manufacturer, and only through the authorized vendors who are authorized by the manufacturers, we get those approvals, validity, checking of their storage and capability of the supplies. All these are very important factor which is considered to introduce in a hospital.
Another question, like, I mean, I'm not sure. Lot of people are talking about Industry 4.0. When we see the technology and the procurement, when we see is going to the next level where everything is automated, you need very less human interactions. How automation is playing, like we know what stock we have in the inventory because there are sensors attached to it, or how the things are moving in the inventory, which is providing the faster speed and less reliability on those kind of calamities and challenges in the organizations. So how you think, like, maybe we should be ready for that, and how it can play an important role in growing us to the next level? Everybody is talking about AI, everybody is talking about Industry 4.0. When we look at it in the supply chain perspective, to do the speed for us, would like to know your thought, like how much you are in support of technology playing a bigger role in fulfilling procurements.
See, technology plays a very important role, but along with the technology, it is only supporting us, it is guiding us. So with the expertise, the supply chain person also, they have to consider a lot of things. Everything is not automated through the systems. So we have to again review on the seasonal impacts, on any pandemic or epidemic, so that we can have a buffer inventory, so that if suddenly, like we have, or everyone has seen that COVID pandemic. So if it again comes, how are we prepared for that? So it is the vendor supplier relationship, and not only the AI or system calculated report. So we have to identify the vital, essential, desirable items in the masters, so that we can identify what is the minimum buffer stock which we can keep. The life-saving items or the emergency items, like we have a PPE kit and all these things which are required in such type of things. It is not the last moment preparation which we go when it comes. So we have to be well prepared. So not only AI, automation, digitization, what we see, it is enough. The expertise, the supply chain person has to review all those things to consider the supplies and inventory chain.
Ashish, I would like to add somewhere in perspective of speed. Speed plays a very important role when we talk about the supply chain, right? Nowadays, you see everybody is optimizing for the speed, right? As a human, we have the temptation when we order something, right? We just want to take it as soon as possible. And you see Zepto, Swiggy, everybody is optimizing for the speed. One is saying 20 minutes, another one is 10 minutes, right?
You stole my next question. Actually.
Yeah. So in that perspective, I want to say for the hospitals, like if there is a small medical equipment, like if it is under 1 lakh rupees, hospitals don't need to spend a lot of time on the procurement in that case. Like you are collecting all the quotations manually and you are taking 1 month time to procure that. It's really very easy nowadays to compare online specifications and compare the price and procure it fast as soon as possible.
Yeah, nowadays technology is like you need something, just open an app, order on Blinkit, Zomato, next 10 minutes they are here. Medical supplies, medical procurements. There are products also in tier 2, tier 3 cities when we talk about consumables which have a very short expiry date. Right? When looking at those products and when looking at how other industry, I mean, people are talking about. Few days back, our minister commented on that, and one of the founder of a $1 billion company responded that we are giving jobs. Looking at that perspective, when you see healthcare, supply chain, procurement, do we really need that? Is it required? Can't we plan ourselves? It's a very amazing selling point for company like hospital store, that you don't need to store inventory in your warehouse, where you can incur cost on managing it and taking a knowledge of it. Because I understand technology is there. When we have the product in the inventory, we need to manage it. The cost starts from us. I know a company where 5 crore rupees of stock were lying in the central inventory and they were not aware about that. Right?
Right. That is a big loss for the hospital in the long term.
Right. So if they don't know they have inventory, how they can sell? Somewhere, big company, they are claiming to be technology aware and implementing those things. Human errors happen, right? So we can understand that. But again, what do you think from reimagining procurement and supply chain in India right now? Do you think we should compare with Blinkit, Zomato as a procurement, maybe for consumables or CSSD items, or I don't know. What do you think? What are your thoughts on that?
I would like to add somewhere.
Sure.
When we talk about the reimagining of the supply chain, let us talk about the pain points of the small and mid-sized hospitals in India. Small and mid-sized hospitals in India face delay in procurement, non-standard pricing, and fragmented vendors and suppliers network. And this kind of challenges can be solved with the help of technology, right? So when you can get anything just with the help of internet, right, then you are making it accessible for the hospitals, and you are making it fast. I said agility, you can making it visible and fast for the hospitals.
Looking at like how the industry works, how doctors are happy with certain products. I need certain type of catheters, I need that only. I am not happy with other products, other brands. Looking at, because they are going to use it from procurement point of view, we have to adapt to that also. Looking at that, there are a lot of companies who are making innovations and trying to enter into the market, trying to convince doctors about buying their products, new products. Looking at from the government policy perspective, we should also be supporting new institutions, new startups, but looking at the quality and compliance perspective, that whether I would be happy to use that. These are very, very critical scenarios. When you are in OT, you need something. You will not be happy with other products if you are not used to it. How that is playing a challenge in procurement. say for example in the terms of resilience, in the terms of war-like situations, we don't have other options. Are we comfortable using them? Are we good to procure them? What are your thoughts from the government perspective?
Government has given you the option which is called a proprietary article. If you want something and it is really life-saving, they offer you the things and it is called a proprietary article. So we follow a GFR. GFR rules are like finance rules. So even the finance rules has given you the simple solution. Why do you require that item? That has to be filled and you can take that item. But now the thing is that killing the competition. Even if you're talking about the government point of view, if you in the clinician challenges, he want to give the good outcome to the patient. He want to treat the patient. But if he require the good article, I think so in the critical scenario it should be given. So we have a provision of PAC. But yeah, very rightly said, in the war-like situation, how when you are not getting the items, there is an issue in the supply chain, how you get it? So the thing is that the user and the clinician should be adaptable to all other scenarios. They should use the product. If he cannot use on the critical patient, he can use the semi-critical patients. So this is the thing. But yeah, government has also the provision of a proprietary article buying, which they have to adhere and they can get it.
Your thoughts, Mr. Vikas?
So my thoughts on that, ki in healthcare, we can't compare or we cannot compare healthcare with Swiggy, Zomato, etc. Because in healthcare, we are not selling the products. We are providing the services. And patients are coming to the hospital with a trust. And with their 10 minutes or 20 minute services, how my clinician trust on that product? So they have to be rest assured. They have to see, check, test and try it and then use on the patient.
But it is doing a lot of cost saving for the organization.
No, but for a healthcare, the first is quality, trust and services, and the cost comes second on that part. Second, in a healthcare, there is no second chance. If I ordered, if this is not available, I can take a second menu over there. But in a healthcare, the clinicians don't have a second choice. So whatever we are using, that has to be complied with the norms. Because in healthcare, so many rules and regulation has to be complied. Like CDSO rule, Drug Cosmetics Act over there, and the other FSSAI license, etc. As well as new clinical and establishment, etc. So we have around 150 licenses, etc. So whatever the services and product we are using, that has to ensure all the compliances over there. So our resources are reliable, trusted, and we have a long-term partnership so that they can support us even the emergencies and urgencies.
There are organizations which have multiple branches and procuring products. One model is having a central repository, big inventory store, and then distributing it to local, regional locations. Another one I'm very impressed with the Fortis strategy is like buying directly from the vendors. So do you think that again central procurement for some organizations because they have the buying capacity, so that also plays an important role? If I am buying 20,000 crore rupees of products in a year, I am a very big company like Apollo, right? I have the upper hand on procuring products. I'll be doing central procuring rather than like the regional procuring. So what are your thoughts on that? Like what method work? Again, pricing is coming, but quality also plays an important role. Trust also plays an important role. And as you mentioned, we are in the service industry, patient come first. So how do you see that, like the price comparison, maybe with respect to price or with respect to time?
So if we see for the centralized and the decentralized system of supply chain management, so we have to consider in both the system the three things: quality, cost and availability. So if the hospitals or the chain of hospitals are in a metropolitan cities where all the manufacturing companies or the top suppliers, distributors, aggregators are available, so in that city, making the central warehouse is just duplicating the work over there. But with the tier B, tier T cities, remote areas where there is a outreach of the suppliers is very less. The manufacturer companies don't have their stockist over there. Where the company can set up their own center stores and supply to their network hospitals, then can save a lot of time, cost as well as efforts also. So it's just a business model which the company is adopting, considering the geographical locations and what the outcome they need from the business.
Yeah, but we are trying to here compare with different scenarios. I mean, organizations are facing and doing well-tested business models, but the innovation comes with disruptions, right? So we are always here to challenge, because this is a platform, an amazing platform to discuss those thoughts and share our opinions on that. Ma'am, Asha, you are...
Yes, I would like to add something. Vikas was saying that we cannot compare with Zomato and Swiggy. I just wanted to say, like in past, 8 years, we did not find a single customer who said we don't need the speed. Everybody, they want on speed, right? When you are meeting the quality, right? When you have the available stock, right? And let us take the two options. One person is saying that we have the stock available here in India, and one is saying that supplier is saying it will take 1 month time. Product are the same. Then which would you prefer? Definitely that is coming faster, right? So speed is an advantage, right? That will help you to increase the care of your patients, right?
Right.
Mr. Sonu, I just have a question in that, because in healthcare, speed is not only the thing of the criteria of the treatment. So when we are working in a retail chains, nowadays we are listening in the industry that lot of discounts on the medications, online medications. So how we ensure that those medications are as per the compliances, they are from the proper source? Because if the source is not right, the patient will not get the benefit of those medicines.
Yeah, very, very important question. I was coming like to understand pharma also. How that procurement is happening, challenges are happening, time is playing an important role.
Procurement, I told you, in a healthcare, in our corporate hospital setups, we have a proper committees, we have a formulary which is identified with consultations with the doctors, and only those brands we use in the hospital. It doesn't only impact on the cost. Before cost, the quality is important, because every hospital, there are a lot of quality indicators which we measure. So like supply chain, if we are adhering to a formulary, we get a cost benefit. We get a better quality care of the patient.
Right.
And that formulary, if we deviate, we also know how much differentiation, because when we have a bulk single brand for the complete hospital, we have a buying capacity. So obviously the cost goes less. So that is a primary factor. And besides cost, a lot of hospitals, every hospital has a KPI, not only for the supply chain, for the administration, they have a key performance indicator where they have to reduce the patient's length of stay. So patient length of stay is again related to these quality medications. If we use just low cost medications, the length of stay will increase. So it will directly impact on the revenue. Supply chain is not only a single department now. Supply chain, in the industry, we are related to our finance, we are related to our
lot of stakeholders.
admin. So each and every department, supply chain is a touch point. Without touch point, you cannot move anywhere.
Right.
Be it a syringe, be it a capex or high-end equipment.
So very, very well said. I mean, you almost like summarized it up by providing various stakeholders are involved in procuring. Also, we have seen from reimagining perspective, we are not wanting it to be next Zomato or Blinkit. There are a lot of maybe vendors available here in the audience. If anybody would like to ask question, these guys buy products. So, any questions from the audience? Anybody interested?
For supplying medicine, for supplying healthcare products and other consumable products, did we require any certification as a company? Drug license especially, if we are not into the drug.
So when the hospital buy certain products from the manufacturers and distributors, so we require a lot of certification. One is the quality certifications, like approval from the CDSO, if it's a drug, or is a medical device certification, if it's a medical device or instruments over there. Besides this drug license, FSSAI license, if it's coming in the FSSAI license, so we require a FSSAI license. We require for the drug batch report and their drug distribution and drug manufacturing license also in the case of drugs over there. And in some cases, when the new innovators are coming and new drugs are coming in the market, so we require their API certification also, that they are doing the API from the right authentication sources. Besides this, GST certifications and their MSME certifications, these all are our part of the RFQ and RFP that is also required.
Thank you.
Thank you. Thank you. Such a wonderful panelists. Very diverse thoughts and very amazing perspectives. Thank you.
Thank you, panelists. That was a very insightful session. Ladies and gentlemen, now I would like to invite Mr. Afzal Kamal on the stage to felicitate the panelists. Give him a big round of applause, everyone. Ashish Rohilla, founder and CEO, Ashish Rohilla and Company. Vikas Goyal, SCM Head, Fortis Memorial Institute. Survpriya Singh, Biomedical Engineer, ILBS. Asha Pant, Deputy GM, SCM, Dharamshila, Narayana Hospital. Sonu Kumar Yadav, founder and CEO, hospitalstore.com. Thank you all the panelists. Now I would request the panel for a group photograph.